patient has come for Pmma Try In. We have scanned the implants and have put back the temporary bridge there. So we'll have to remove this. I'm going to tap it out. One more. There, it was already out. So this is the temporary fridge that he's been wearing. So Pmma is back from the lab. They have made a digital model of it. It fits the model very well. The model is of the implants with the fridge analogs. So now we put at least 3 of these caps, 1 in the front, 2 in the back. So here, so that we put at least 3 of the caps to stabilize the Pmma. Nice fit. So it's sitting on the cap. You see the Pmma comes all the way up to the shoulder of these impression caps, the fridge analogs, right there. So now we want to check the bite. First of all, we'll check, make sure there is no tissue impingement. There is not too many spaces, no. That's good. Good, and bite down, please. It's a beautiful occlusion. Nice. Now, color and appearance wise, that we have to ask the patient for feedback. So I'm going to sit you up and give you a mirror. This is a replica of what your final one is going to be. The final will be different material. This is all plastic, so we can make any kind of changes we want. How do you like the...
Looks good.
Like it?
Yeah, looks good.
All right, beautiful.
Feels better than the other one.
Oh, sure, sure. And the next one's going to feel better than even this. So that's the Pmma Try In. Now, this ended up being really good, but points to consider is, of course, the occlusion, the arch, and the intaglio surfaces that we don't want them to be concave. So any convexity, we'll take the acrylic wear and adjust it. This should be completely cleansable by the patient. So these concave surfaces should be made convex. Now what we do is we do a 360-degree scan of this. Unfortunately, none of these had to be changed. I like the separation. I like the shape of the teeth. This is when we decide whether to do pink or not. Are we doing pink? Okay, the bulk for strength, I still needed on the lingual of 26, 27, 28, 29. See these areas, this is a weak area because it doesn't have much height and it doesn't have much width, so this is a weak spot on this restoration. So you want to bulk it up from here. Yeah.
Okay.
This, however, even though it's as thin, but there is so much material on top of it, so that gives it the strength. Did you say we are doing pink or we're not doing pink?
I see a note saying we updated to add pink.
Yes, add pink. Okay.
So yes.
Then there is room for pink here, so we're gonna add a little pink in this area. So pink should be from maybe 21 through 27.
Okay.
21 through 27, we can add a little bit pink.
Okay.
And then otherwise, it's good.
Okay.
What also I like to do is I like to make the edges, the incisal edges a little bit thinner. So what they will do is they will superimpose this 360 scan of this that we're going to send them over what they have in their program, and whichever area is missing from it, they will remove from that before going to mill. And then if I had added something, okay, let's show how we ask them to add. Give me a piece of Robotech. I'm going to show you how we can add and tell them to add to it. So I had asked them to reinforce this area. Well, they may be confused as to how we want it reinforced. So here is a piece of light cure acrylic. I'm going to put it here and adapt it, and this is how we want the reinforcement. Of course, they're going to merge all this so it doesn't look like a patch up the way this is looking. Let's see, I'm thickening it here because this is the weak spot. It doesn't have much vertical height and it's wide. Typically with these shades we can make it with the Broxy, which is plenty strong, and I don't think it's going to be any problem. If there's a very light shade, then we want to do it aesthetic zirconia, then this bulking business becomes much more critical. But here we're using the Broxy material that has 800 megapascal strength, and it should do with these. Can you light cue this? So now when we scan this, there are all of these places that has not been modified, so that they can superimpose with the existing design. Then the area that is scanning more, they will add to the design, and the areas that I reduced because convexity, they will take from the design. Oh, and also I thinned the incisal edges. Visual edge. So the changes were: one, removing concavities on the intaglio surface; two, thinning of the incisal edges from the lingual; and three, reinforcing the right side. See, on the left side it's much thicker than this, so this doesn't need reinforcement there. Excellent. Overall, this was minimum work that was needed. I think the lab is designing it more like what we are asking them, and we'll need less and less modification. The occlusion was perfect. It was seated on all the three. So now this patient is done. We're going to remove the page analogs. The hemostat, rotating it, and then we'll put the temperature. Actually, we can clean it. See, obviously this patient forms a lot of tartar, so now that we have it out, go ahead and clean these and then see them. Yeah, we'll clean it and seed it, and then next time it's going to be ready. 2 weeks.